Hi, I'm Professor Daryl Hawkins, and I'm the director of the NRC and Simulation Center. This is Tatiana Rodriguez, our simulation technician.
Hi.
And this is Deborah Taffe, our simulation coordinator.
Hi.
Hi, and welcome to the NRC and Simulation Center at Barry University. My name is Professor Daryl Hawkins, and I'm the director of the NRC and Simulation Center. And today, the purpose of this video is to show you the intro to the lab and to get you acquainted with the Sim Center staff, and also to give you some guidelines to make your simulation and lab experience meaningful. Thanks. Our mission here in the NRC and Simulation Center is for learners to use patient care technologies and clinical reasoning skills to help prepare them to become competent healthcare professionals. We believe that learners are best motivated through self-directed experiential learning, and activities in the lab in the NRC Center will prepare you to do just that. The NRC and Simulation Center has a couple of different clinical areas. The first of which is this larger lab area that has 4 patient beds that are typically occupied by mid-fidelity mannequins. These mid-fidelity mannequins are used for you, the learner, to practice your nursing skills. So take a look around. Another area that we have in the NRC and Simulation Center is an outpatient clinical setting. In this area, we have an exam table and other equipment that is typically seen in an outpatient setting. This is used for health assessment competencies and simulation experiences that take place in the outpatient setting. In the NRC and Simulation Center, we also have 2 simulation rooms. The simulation rooms are set up as realistically as possible, like a clinical room that you would see in an inpatient setting. In our simulation rooms are high fidelity mannequins, and what that means is that they are the highest, most realistic mannequins that we can get for you to train on. So this mannequin can blink, he has lung sounds, heart sounds, he has pulses, you can take his blood pressure, you can insert an IV. Basically anything that you would do in real life to a patient, this mannequin can do, and he can even speak. So part of the reason why we try to make this as realistic as possible is because we want students to be able to practice their clinical reasoning skills and nursing skills prior to going out into the inpatient settings with real patient. It allows you, the student, to be able to practice your skills in a safe but highly realistic manner.
Hi, I'm Deborah Taffe. I'm the Simulation and NRC Coordinator. Anytime that you have a skill in the lab or the simulation area, you're required to wear your blue clinical uniform, white shoes, hair up, and all your equipment. Prior to simulation or lab activities, you might have to do some pre-work. Those assignments will be given to you by your professor. Attendance is mandatory. If you are 5 minutes late, there is that is considered the grace period. If you're 15 minutes late, that is considered an absence, and you will have to reschedule your activity. There are no food or beverages allowed in the lab at any time. Everything we do here in the lab is considered confidential. So if we're discussing a case or a student is presenting, that is considered confidential.
Hi, my name is Tatiana Rodriguez, and I'm the NRC Simulation Technician. Today, I'm going to talk to you about equipment. All the equipment must be utilized as instructed by your instructor. If you do otherwise, you will be asked to leave the NRC. When disposing of needles or syringes, you must make sure to dump it in the proper container. If the container is full, you must let us know. If by any chance you get stuck by a needle, you have to let the NRC staff right away. Once you're done with simulation, you will have some equipment left over. We will be asking you to dump all the equipment in one of these bins. Markers and pens are not allowed near our task trainers or mannequins. You must wear gloves at all times when operating them. If you have any allergies to latex, please be sure to let us know. Please be advised that some of the task trainers and equipment has latex.
Thank you for visiting the NRC and the Simulation Center. Remember that the lab and the Simulation Center is really here to serve your purpose. We typically open lab hours where students can come and practice their nursing skills. This is posted outside in the hallway, outside of the NRC and Simulation Center. If you require hours that are not posted there, please feel free to contact any member of the NRC and Simulation Center staff, and we'd be happy to set aside an appointment time to work with you. And again, thank you, and we look forward to seeing you in the lab.